All right, today we're diving deep into a health topic that is incredibly common, but, it's also really misunderstood. We're talking about polycystic ovary syndrome, or PCOS for short. It affects millions, so let's get into what it actually is and why it's so important to understand.
So let me start with a question for you. What do you think is the single most common hormonal disorder for women of reproductive age? Well, if you guessed polycystic ovary syndrome, you're right. And its sheer prevalence is exactly why we need to talk about it.
For so many people, the experience of PCOS starts out like a confusing puzzle. You've got all these different symptoms that honestly seem like they have nothing to do with each other. But once you start putting the pieces together, a much clearer picture starts to take shape.
So let's look at the first puzzle pieces, the ones you can actually see. We're talking about things like persistent acne that sticks around way past your teen years, or maybe excess hair growth in places like the face or chest. That's a condition called hirsutism. At the same time, you might notice the hair on your head is thinning. And then there's that stubborn weight gain that just seems to collect around the abdomen. These are often the very first clues.
Okay, so that's the outside. Now let's talk about what's going on inside the body. A huge one is having really irregular menstrual cycles. Maybe they're super infrequent, or they last a really long time, or sometimes they just don't show up at all. And the condition actually gets its name from the small, harmless cysts that can sometimes form on the ovaries.
So, with all these different pieces on the table, what's the clue that ties it all together? Well, it's the diagnosis itself. Let's finally give this collection of symptoms a proper name.
Officially, polycystic ovary syndrome is a hormonal disorder. The key word there is syndrome, which just means it's a collection of signs and symptoms that are all traced back to hormonal imbalances. This isn't just a random set of problems, it's a recognized medical condition. So just how common are we talking? Well, get this. It affects up to 1 in every 10 women of reproductive age. That is a huge number, and it really means that if this is something you're dealing with, you are definitely not alone.
Now that we know what PCOS is, let's do a little investigating. Let's look at the why. Because really, understanding the root cause is the key to understanding the whole condition.
Maybe the easiest way to think about what's happening is to imagine crossed signals. Our bodies run on this incredibly complex communication network of hormones, and with PCOS, some of those signals just get a little scrambled.
So, here's how that chain reaction usually plays out. It often kicks off with something called insulin resistance. Basically, the body cells aren't listening to insulin properly, so the pancreas just starts pumping out more and more of it to try and get the message through. All that extra insulin can then trigger the ovaries to produce higher levels of androgens. Think hormones like testosterone. And that hormonal imbalance is what disrupts ovulation, which leads to the irregular periods and the cysts. It's like a domino effect inside the body.
Okay, so given this complex picture, how do doctors actually connect the dots and arrive at a diagnosis? Let's break down that process, because it's not as intimidating as it might sound.
Most of the time, doctors use a pretty simple guideline. It's often called the 2 out of 3 rule. It's a really effective way to make an accurate diagnosis, and it means you don't actually have to have every single symptom to be diagnosed with PCOS.
So here are the 3 criteria they look for. First, those irregular or absent periods we talked about, which is a sign that ovulation isn't happening like it should. Second, high levels of androgens. This can be confirmed either through a blood test or by physical signs like hirsutism. And third, seeing polycystic ovaries on an ultrasound. If you meet at least 2 of those 3, that's usually when a diagnosis is confirmed.
So, getting a diagnosis, it's really not the end of the story. In fact, it's usually the start of a whole new chapter. So let's talk about the path forward and how PCOS can be managed with what's called a holistic approach to wellness.
I think this is such a powerful idea. Look, a diagnosis can feel scary, but it can also be incredibly empowering. It finally gives a name to what you've been experiencing, and it gives you a framework for how to start taking back control. It really is the first real step toward understanding your own body.
And when we talk about management, it's not just one single thing. It's a multifaceted approach. As you can see, lifestyle changes are a huge piece of the pie, but medication and mental health support are also absolutely crucial. It's not about a single magic bullet, but a combined strategy for long-term well-being.
So what does that look like in the real world? Well, it often starts with diet and exercise to help improve that insulin sensitivity we talked about. And that's really key, because if it's not managed, PCOS can raise the risk for other things down the line, like type 2 diabetes or heart disease. It can also mean medications to help regulate cycles or manage those androgen levels.
For some, it might involve fertility treatments, and, this is so important, it includes support for your mental and emotional well-being, because living with any chronic condition can be tough.
Okay, so before we wrap up, let's just quickly recap the key takeaways. First, PCOS is a very common hormonal disorder. Second, it's diagnosed using that specific 2 out of 3 rule. The root cause is a hormonal imbalance, which is often tied to insulin resistance. And finally, the best way to manage it is with a holistic approach, one that focuses on lifestyle, medication, and your overall well-being.
And I want to leave you with one final thought to chew on. Because so many of the struggles with PCOS happen on the inside, they're not always visible to the outside world, it can feel like a really isolating condition to have. And that brings up a pretty important question for all of us, really. How can we do a better job of creating awareness and support for invisible conditions, just like PCOS? Thanks so much for joining me today.